WellSpan Philhaven is really a merger of two entities. WellSpan is a large integrated delivery system. Philhaven is a freestanding psychiatric hospital, one of the last ones in the country actually. And so a merger in 2016 actually developed WellSpan Philhaven. It's really an integrated delivery system that has a large behavioral health component, actually the largest in South Central Pennsylvania. And the goal really has been to figure out how can we expand behavioral services so that we really can provide a very comprehensive behavioral health platform.
We exist and function within a large healthcare system, WellSpan Health, really to leverage our expertise so that it has the greatest impact on the greatest number of individuals. So it has a variety of components. One is a training component, and we've trained over 1,000 WellSpan employees of how to deliver care to folks with autism or intellectual disabilities.
We provide consultations to inpatient behavioral health units, to the emergency departments, to the medical floors, and it's really about how can these individuals get really good medical care?
We've had a number of great accomplishments over the past several years. We have crisis intervention services where people actually go out to your home. And what we find is that most people, when you're engaging with them at home, they're able to actually get back to a really great place of health fairly quickly. The other thing that we've done is that if there's an acute problem happening, say a death or a breakup or something, people can actually come into an office that we have and they can talk to a crisis counselor. Sometimes it just takes an hour or two to just sit there and talk to somebody about it, feel much better, you're able to go home, and then you can follow up if you absolutely need to. About 60% of our appointments are done through telemedicine services, and so we're able to actually see people when they're at work on their breaks. We can see people at home in the evenings. We've been able to reach more people more conveniently, and actually it's increased our patient satisfaction scores.
Universal services, targeted treatments, and intensive treatments are a stepped approach to care so that folks are getting what they need when they need it. We have particular partnerships with primary care, so pediatrics, family practice, where we've really worked hard to improve access. So rather than waiting months or even a year to get into care, folks can obtain a diagnostic assessment within 3 months and an assessment for folks with an existing diagnosis within 1 month.
WellSpan Health is very committed to always keeping the patient and the community at the heart of everything that we do here. And our first class of 6 residents are going to have a unique training opportunity in one program to train at a level 1 trauma center, multi-specialty community teaching hospital, and a full-fledged behavioral health campus, and a center of care that specializes in treating the behavioral health needs of individuals with autism and developmental disabilities. And with our system's footprint across urban, suburban, and rural settings, that means that the residents are going to learn how to address the unique needs of so many different individuals and communities.
Located on the campus of Philhaven, the WellSpan values align very nicely with the culture of the Plain community, such as working as one, finding a better way, respect for all, and we work very hard within the clinic to ensure that we're aligning WellSpan with respect for the culture.
How I define Plain community is very conservative in their outlook in life, in their method of dress and practice. In the Plain community, part of whom we serve consists of Old Order Amish, Old Order Mennonite, Old Order River Brethren. And one of the almost unspoken guidelines is if the church requires the ladies to wear a prayer veiling, they are eligible for services here. And that helps the services to be offered where they feel comfortable that their faith is valued.
I do find it's important to incorporate spiritual integration into our care because that is a core value of the Plain community. And the ways that we do that are by being conscientious of that in our treatment planning and safety planning. We can refer to scripture from the Bible if that's something that would build a connection with them and build upon their treatment.
What we find is many times people have a very poor understanding of mental health, and they may attribute it to sin or other types of behaviors that are not acceptable. And when they understand that bipolar is not a choice behavior or schizophrenia is not a choice behavior, then they are much more able to support the individuals.
So we really take the time to understand the community they're from and what their understanding of the biblical principles are in their community to ensure that we're aligning that here in their care. And that also comes into play with med management as well. We work very hard to align their desire for natural remedies with medications.
What we see within the Plain community, being a very disciplined community by and large, is that the symptomology is much more subdued than it would be in the non-Plain community. They may be much more ill than they appear, and by the time they come to our clinic for services, they are indeed very sick and they're completely unable to function. And having them return home, being able to function, is considered a positive outcome. And then seeing them thrive and hearing from them from time to time is icing on the cake.
I just wanted to reach out to you and thank you for all you've done for me today. I feel comfort and relief after speaking with you today. You made a huge positive difference in my life. This was a 25-year-old woman. Those are the pieces that make me most proud.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.